right. Well, with that, why don't we go ahead and get started? And I'm going to say good morning to those on the West Coast. Good afternoon to those here on the East Coast. And thank you for joining us. On behalf of Ovation Healthcare, I'd like to welcome you to the Voice of Quality Care, the Patient Experience and Safety Connection. Before we go any further, I just want to address a few housekeeping items, and then we're going to get things kicked off. First of all, after today's webinar is complete, you will be receiving an email from Leapfrog with the slides that are going to be presented today, along with the recording of the event. So feel confident you'll receive those, no worries. And secondly, we would love to hear your questions today as well. So please feel free to enter your questions into the chat along the way. You can direct those to hosts and panelists or to everyone. Just go ahead and enter those into the chat, though, and we'll address those at the end of the presentation. And with that, let's kick things off with some information about our speaker. So today's presenter is Dr. Christine Kiefer-Wolf. She is a healthcare executive with over 25 years of system and business unit-level healthcare experience with a history of creating and improving workplace culture, employee engagement, and patient outcomes. She's known as a transformational leader skilled at relationship building with internal and external partners. She's also experienced in labor relations and building shared governance models. Christine's known for building and leading teams in a collaborative and supportive environment. She's worked in many complex environments, always striving for the best possible outcomes by keeping the patient as the guidepost. She is committed to mentoring and developing others to support their leadership development journeys and understands that by building stronger leaders, we'll realize stronger patient experiences and outcomes. Christine was the facilitator for the Center for Healthy Nursing, a collaborative amongst the UPMC Center for Nursing Excellence, the UPMC Health Plan, and the University of Pittsburgh School of Nursing, which focused on improving the health of nurses as well as the environments in which they work. Her doctoral work, implementation of a peer review program and evaluation of its impact on nurses' perceptions of the peer review process for patient safety events in an acute care hospital, was implemented at UPMC. Quickly, let's just review today's learning objectives, because at the end of today's program, you should be able to describe the body of evidence that connects patient experience and quality and safety, discuss how the organization can embrace patient experience to improve the care you deliver, and state one measure of the Leapfrog Patient Safety Survey that your organization will be able to positively impact. And with that, I'd like to hand this over to Dr. Wolf. Take it away, Chris.
Thank you, and good morning and afternoon to everyone. Thanks so much for joining. So excited to be here with you today, and thanks to Leapfrog for having us host this webinar. We're going to just jump right in, and let's start with patient safety as a strategic priority. So healthcare is personal and safety is paramount, and how we partner with patients to deliver high quality of care is more important than ever. In our complex healthcare systems, patients interact with a multitude of touchpoints along the healthcare continuum, and they possess the only firsthand knowledge of the experience of care being delivered to them. So consequently, their voice can be one of the best sources of information that healthcare organizations can use to improve quality and safety. Isn't that a wonderful thing that we have that resource? With an ever-growing body of evidence that demonstrates the connection between positive elements of patient experience and both process of care measures and healthcare outcomes, patient experience has become integral and fundamental in the evaluation of the safe quality of care being delivered today. So today's webinar will highlight those connections and discuss ways healthcare organizations can embrace patient experience to improve the safety of the care that they deliver. So let's get into some detail. So the burning platform is obviously patient safety. And to understand the severity of the situation, you need to look no further than Leapfrog's website, which has made these startling statistics available to everyone. When you consider how safe healthcare is, the numbers tell a little bit of a disturbing story. So upwards of 200,000 people die every year from hospital errors, injuries, accidents, and infections. Every year, 1 out of every 31 patients develops an infection while in the hospital, an infection that didn't have to happen. A Medicare patient has a 1 in 4 chance of experiencing injury, harm, or death when admitted to a hospital. And today alone, more than 500 people will die because of preventable hospital error. So consequently, efforts must be focused on creating a safer patient environment where we can deliver high quality care without fail. And because the best way to address errors is to obviously prevent them altogether. So over the years, there have been several publications that have addressed the healthcare safety crisis and how to best address it. Some of this is probably going to be familiar to you. In 1999, the U.S. Institute of Medicine, or the IOM, released To Err is Human. It was a landmark publication that brought the issue of U.S. medical errors to light and then pushed towards building safer health systems. It also stated that errors were not rare or isolated, and only by broad planning could they be diminished. It is also described that most errors are systemic in the healthcare industry and cannot be resolved at the level of individual healthcare providers. So later in 2001, the IOM followed up with Crossing the Quality Chasm, address gaps in efficiency, effectiveness, timeliness, and patient-centeredness. It was considered a second, more comprehensive report focused on the other problems and limitations of the existing U.S. healthcare system. This report would focus more broadly on overuse, which is applying medical resources and treatments with insufficient evidence that they lead to greater outcomes, or underuse, failing to apply resources or treatments with known benefits, and then misuse, failing to execute care safely and correctly. The inspired movement from the Institute of Healthcare Improvement, or the IHI, to create a framework for high-performing healthcare and a roadmap towards better population health and an improved economy, called the Triple Aim, which some of you probably know, which was back in 2007. And if you're not familiar with the IHI, it is an organization that is widely known for using improvement science to advance and sustain better outcomes in healthcare around the world. So a comprehensive framework was designed to serve as the foundation for optimizing health for individuals and populations. The end goals of the Triple Aim were to deliver better healthcare and an improved economy. Sounds pretty simple, doesn't it? 3 original focus areas included an improved patient experience, including quality and satisfaction, better outcomes, and lower costs. It brought the importance of patient experience to quality healthcare into the conversation, and additionally, it has since evolved to expand to include, necessarily so, clinician and caregiver well-being. This was added as an extra component back in 2014. However, I would say that with the pandemic, that even became more of a priority on organizations' agendas across the country. And then also health equity. It added another component in 2021. So now that you've seen the evolution to now include patient experience in the conversation, we can address how best to evaluate and improve it to move forward. Let's start by level setting and addressing what we're really talking about here, and that is the patient experience. So early on, when healthcare began to bring elements of patient experience into the conversation about important improvement opportunities, many organizations tried to address this with elements of what we called customer service exclusively. Looking at non-healthcare industries as success stories, there was a time that we talked about having a great customer service experience in healthcare. And when in truth, the modern approach to patient experience really goes much further beyond that. And it acknowledges that healthcare is personal. And it is not just about the amenities or the niceties that we may have focused on in the past, but rather about the need to elevate and expand the definition to patient experience to something much more. The Barrel Institute, which is one of the leading organizations in the patient experience space, has created a definition that I think will help us to level set here. Patient experience encompasses the range of interactions that patients have with the healthcare system, including their care from health plans, from doctors, nurses, all staff in the hospitals, physician practices, and other healthcare facilities. The image display here is one from AHRQ, or the Agency for Healthcare Research and Quality, and gives a great visual of what is included in the larger definition. As an integral component of healthcare quality, patient experience includes several aspects of healthcare delivery that patients highly value when they seek and receive well-coordinated and high-quality care, such as getting timely appointments and easy access to information. Also, it includes a very patient-centered approach with shared decision-making, self-management support, and culturally appropriate care at the forefront, all delivered with good communication by their healthcare providers. There is also an acknowledgement that the patient experience is part of something much larger, and we call that the human experience, which also takes into consideration the associated experiences of the healthcare workforce and the communities in which they serve. The alignment and integration of all of this brings us to a more effective space for improvement. So the approach to patient experience improvement has certainly evolved over the years. You all probably have great examples in your own organizations. Historically, we address patient experience needs in response to patients independently interacting with different silos in the healthcare system. It was also how we typically managed ourselves organizationally at the time. We looked at care being delivered in separate silos, but that is not how things really work. So when we think about patients going to the ED versus the inpatient setting versus the ambulatory setting, it was a very distinct experience and addressed improvement opportunities separately. But that is not how aligned with patients think of how their overall experience is, or how they need to experience care for those optimal outcomes. Here's an example. A patient may come into your ED complaining of chest pain. They likely will have labs and imaging done. They may even have a heart cath in your cath lab and may get admitted to your inpatient department. They'll interact with new specialists along the way, and then once they're discharged, they'll have to navigate the healthcare system again to have follow-up appointments with cardiologists, primary care physicians, and maybe even surgeons. As a healthcare system, we'll think of that patient's experience in care in buckets: the ED, the inpatient, ambulatory surgery, medical practices, and so forth. And we'll look for separate ways to address those opportunities, but the patient will consider all of that as one continuous and potentially life-threatening event. And in this case, they will think of all of that as when I had my heart attack. So we need to think about the patient care experience in a better way, using an integrated model that keeps the patient at the center of their care and also aligns their care across the continuum. So what do I mean by that? Better partnerships across departments and a coordinated approach to delivering care. Every experience and handoff should instill confidence in the patient that we are all working together to deliver safe and high quality care to them, and that they will be at the very core of that experience. They need to be engaged in the communication in a patient-centric way. And we're going to keep talking about that, patient centricity. And the need to be able to trust in us from the start to the finish. Their voice needs to be heard and respected consistently across all of those healthcare spaces. And we need to consider them essential partners in delivering safe care. This does not happen by chance, but better engagement from every aspect of the organization. And that includes our boards of directors, the C-suite, providers, and so forth. Everyone makes an impact. And this requires a coordinated and seamless approach to achieve optimal outcomes, including those quality outcomes. This graphic tells us the story of moving from that siloed approach to coordinated efforts. So I mentioned earlier that it isn't amenities alone that drive a positive patient experience, but rather the elements visually depicted by the AHRQ image that we shared earlier. Not surprisingly, those elements align with what research has shown and how to build patient loyalty as well. So how do we build patient loyalty? What drives a positive patient experience? So according to polling from Gallup, patient loyalty is the combination of good clinical quality and a good patient experience. Organizations that can deliver good outcomes plus high patient satisfaction will be well equipped to build deep patient loyalty. So we need to think about clinical quality as a top priority. Good clinical quality has to be at the baseline of everything a healthcare organization does. If a patient receives negligent care that results in adverse patient safety events, they won't feel loyal to the organization, even if it has all of the bells and whistles of a consumerized healthcare experience. In fact, it's that perception of clinical quality that leads the way in building patient loyalty. And that's according to a June 2019 report from our colleagues at Press Ganey. The report showed that when patients and providers perceive good teamwork, high clinical quality, and provider courtesy and respect, both physician and patient loyalty increase. As a clinician at heart myself, I can tell you that getting a high HCAHPS score is not what got me into healthcare, and that's not why I went to nursing school, but rather it was about the desire to deliver high quality care to patients in a safe environment amongst a team of competent and like-minded professionals. And that is exactly what your patients want as well. So thinking about supporting high patient satisfaction, only after that foundation of clinical quality has been established can other elements make a difference. The patient experience, part of the loyalty equation, can be split into two areas. So let's think about this: healthcare process and people. So healthcare processes, patient access, appointment scheduling and availability, and patient financial experience. And then people, good patient and provider communication, friendly staff, shared decision-making, and patient education. A critical component of communication and provider courtesy and respect is that patient-centered care. Again, we're going to keep talking about that today. So defined by the Institute of Medicine as care that is respectful and responsive to individual patient preferences, needs, and values, and ensuring that patient values guide all clinical decisions. Patient-centered care was officially adopted at the beginning of the 21st century as a core impetus to deliver better quality healthcare in the United States. Its 6 dimensions are listed here, and it includes respect for patients' values, preferences, and express needs. This connects back to know the patient and ensure that we are delivering culturally appropriate care as they define it. Without the patient having a voice here, we can never really know what they define within their needs and cannot really give fair measure to how well we are meeting those needs. The next one is coordination and integration of care. Patients feel safe in knowing that they are being cared for by a well-oiled machine, with each person working in synergy with the rest. Seeing consistently and coordination across those service lines that we discussed earlier helps patients build trust and confidence in their individual caregivers, as well as in the organization overall. Next, information, communication, and education, followed by physical comfort, emotional support, and relieving fears and anxiety. So important. Once again, when caregivers are able to make that connection with patients and give them a voice, we can better understand what is fueling their fears and anxieties and helps us to better alleviate those in a patient-centric approach. What works for one person may not exactly be what works for the next person. So making that connection and giving the patient a voice creates a much safer space overall. And then, of course, involvement of family and friends. One of the biggest learnings from COVID was the importance and the impact that having family and friends close by can have on the patient experience and the safety of care being delivered. With having family and friends, they really have that connection, and then it's a trusted advocate close by. A patient will naturally feel more at ease and comfortable overall. No one knows the patient as well as the patient, obviously, but their family and friends are often a close second and can offer insights and information about the patient being cared for. We need to listen to that. Welcoming their voices into the conversation furthers the patient representation and creates an even safer environment overall. Aside from its ethical and moral imperative, patient-centered care has demonstrated improved clinical outcomes and patients' quality of life while reducing costs and disparities. So why do those patient experience measures matter? As I'm sure you can see and sense by now, we've already been building towards this connection, and this can confidently be done with a growing body of evidence of support. So first off, there is the clinical case. Improving patient experience has an inherent value to patients and families and is therefore an important outcome in its own right. But good patient experience is also associated with important clinical processes and outcomes. For example, at both the practice and individual provider levels, patient experience positively correlates to processes of care for both prevention and disease management. For example, diabetic patients demonstrate greater self-management skills and quality of life when they report positive interactions with their providers. And patient experiences with care, particularly communication with providers, correlate with adherence to medical advice and treatment plans. This is especially true among patients with chronic conditions, where a strong commitment from patients to work with their providers is essential for achieving positive results. And patients with better care experiences often have better healthcare outcomes in general. For example, studies of patients hospitalized for a heart attack showed that patients with more positive reports about their experiences with care had better health outcomes a year after discharge. So think about that. Measures of patient experience can also reveal important system problems, such as delays in returning test results and gaps in communication that may have broad implications for clinical quality, safety, and efficiency. Additional research has shown that all of these following connections play an important role. So patient safety indicators, they are associated with general patient experiences and the HCAHPS measures. Patient reports of undesirable events, they are associated with global rating of care and respect and dignity questions. The technical quality of care, looking at the Hospital Quality Alliance score, that's associated with patient communication with clinicians, experience of nursing services, and discharge planning questions. This survival 1 year post-discharge that we just mentioned, it's associated with patient-centered care, access, courtesy, information, coordination, patient preferences, emotional support, family involvement, and physical comfort measures. Medical compliance, that is certainly associated with patients' faith in their doctor and the patient-provider relationship that exists. And then lastly, medication adherence, closely associated with the level of physician support, participation in decision-making, and information on side effects. So of course, beyond the clinical care and the clinical case lies the business case for improving patient experience as well. Patients are consumers of healthcare. They value publicly reported patient experience data that assists them in making their choices and where they're going to receive their care. And this has become so much more prominent in the recent past. The quality of the provider relationship drives patient loyalty, which can positively impact that patient retention. Financial incentives for patient experience and achievement and improvement exist, and leading to higher profit margins. Greater employee satisfaction can be achieved when connecting patient experience improvement to that quality and safety measure achievement and potentially reducing turnover. Patient experience measures are increasingly being built into performance-based compensation, board certification and licensing, and of course, what's important too are recognition programs. Studies have shown that the patient experience excellence has been associated with lower medical malpractice risk as well. So not just clinical, but also business case for improving that patient experience. So in further considering the business case, let's take a look here at linking quality to the positive financial outcome. So each of the programs included here measure and incentivize healthcare organizations to demonstrate optimal performance or improvement towards optimal performance year over year, reducing readmissions, eliminating hospital-acquired conditions, eradicating those never events, and focusing on other quality outcomes of clinical excellence demonstrate that true commitment to safety and value in healthcare delivery. In fact, the National Institutes of Health have summarized that strong financial performance is associated with patient-reported experience of care, the strongest component distinguishing quality and safety. These findings suggest that financially stable hospitals are better able to maintain highly reliable systems and provide ongoing resources for quality improvement. So healthcare is competitive, but is also personal, and patients are now more engaged consumers of healthcare than ever. I hope you've heard about this term, consumerism. So the amount of quality and safety information being publicly shared on various websites has tremendously increased over the years. And the latest demographic mix of patients are now more savvy than ever before in finding and using this information to evaluate available care. This is another example of the impact and long-term effects that COVID has had upon healthcare. And this is arguably one of the increasing safety of care being delivered. When a patient becomes aware that they are going to need to enter the unfamiliar healthcare space, whether that be a specialist referral from a primary care provider, a new diagnosis that they received, or maybe just a new symptom that they are experiencing, they are going to do some research into those ratings, rankings, and feedback from facilities and individual providers before they take the first step into the unfamiliar healthcare landscape. There is plenty of information available online now. And of course, we are all familiar with the well-known Leapfrog safety grade. And this gives patients an easy to understand and interpret grade for your facility's care and services. Medicare.gov and Care Compare, which allows you to actually compare multiple sites of your choosing. Star ratings, which give you a number and a familiar view on 5-star scales. And provider reviews, whether they be verified or not. And that's important to know. All of this information is out there. May be verified, may not be. They're all easily accessible. So that helps patients quickly see what other people have to say about communication, coordination, competence of available care providers and systems before they make their decision about where they're going to go for healthcare. Each of these sources of information for patients truly transparently provides relevant data and focusing on specific quality and safety measures. It is all out there. Online presence and reputation are more important than ever because ratings are easy to find and influence the choices that patients are making, even if you are the only business in town. Patients are willing to travel for safe, high-quality healthcare and are going to be sure that they get the most value when they can out of the healthcare services they're looking for. Given the growing financial impact of that, this is naturally driving healthcare systems to focus on more than ever. It is out there. And we've had a lot of conversations. Some people don't want to believe that, but the information is there. And whether you partake in that and willingly provide information, it is out there, folks. So when we think about the voice of the patient and HCAHPS measures, One readily accessible measure, obviously, is available online from CMS. This is the data that is used for inpatient comparisons on Hospital Compare, as well as in the calculation of the CMS star ratings and Leapfrog safety grades, and those are just to name a few. It may be helpful to review which measures are included in that data that is publicly available. If you're not already familiar with HCAHPS surveys, they really are the voice of the patient surveys that are specifically administered to patients who have been admitted to the inpatient arena and meet all inclusion criteria as determined by CMS. The survey includes individual questions that sort of roll up to the domains or sections. And for example, the nurse communication domain that is publicly reported is the pinnacle of 3 individual questions that patients are asked to give feedback on specifically. And they include, did your nurses treat you with courtesy and respect? Did your nurses listen carefully to you? And did your nurses explain things in a way that you could understand? Similarly, the same questions are asked about doctor communication as nurses. These questions provide firsthand insight into the way in which the patient is included in conversations about their care and overall health, and how they are educated along the way. We know from the previous slides that patients want clear and empathetic communication in the care organizations from which they receive services. So these measures are of critical importance and have a very strong impact on the overall rating of care that they also provide. In addition, staff responsiveness domain. This reflects the active partnerships that exist in providing the care that is needed by the patient and in the time that they needed it. We've talked about how the care being evaluated by these questions in particular can impact quality measures such as fall rates, pressure injuries, and infection rates as well. Finally, communication about medications and discharge information questions demonstrate the patient understanding of their new medications and care instructions that extend into the outpatient arena. If not delivered in that patient-centric way, the patient may not be successful in the outpatient setting and may be set up for readmissions or medication errors on their own. So while the HCAHPS surveys tend to get a bit of a bad reputation at times, the focus of the questions are connected directly to the experience of care measures that are known to drive those quality outcomes. And it is information that can really only be provided by the patients themselves. No medical record can effectively demonstrate the connection that care providers have achieved in providing care, and therefore only patients themselves can be the ultimate source of this information. Of course, HCAHPS composites are at the top of the list where the patient voice impacts Leapfrog hospital safety grades. But there are other ways in which patient-centered care can impact the safety grade as well. So there's some additional process and structural measures. Let's think about safe medication administration. While the element is specifically measuring barcode administration, the patient's voice can be strong here as well, and so important. Patients should be engaged in the medication reconciliation process and can be a voice of that confirmation in identifying what is being given to them along the way. NQF safe practices. As we discussed, the patient evaluation of coordinated care delivery is paramount in helping to decrease fear and anxiety and support safe care delivery. When patients are able to actively engage with those team members through the identified best practices, such as the multidisciplinary care rounds and bedside shift report, they're able to offer their firsthand perspective on their experience, as well as confirm those details and information to prevent errors. I have seen firsthand many times when it was the patient who provided that good catch and avoided a medication error or other safety errors when they were able to speak up for themselves and provide essential information to the caregiver conversation and in that coordination of care. This type of culture can only be achieved with strong structure of leadership and driven accountability to ensure that these best practices are maintained for the long term. It has to be part of the DNA of the organization. So as far as outcome measures, looking at AHRQ patient safety indicators, it's an active partnership of care between caregivers and patients, and how this can lead to decrease in things like pressure ulcer rates and post-op DVTs or PEs. And then when they are intentionally and proactively rounding to address these positions and needs and ambulate patients regularly, or even decrease the in-hospital fall rates with injury. Again, when they are intentionally and proactively rounding to provide assistance to the bathroom, getting folks up on a regular cadence, and responding to call bells when the patients need assistance. And we can be proactive about that. Strict hand hygiene adherence rates by caregivers and maintenance of general hospital cleanliness, along with patients actively participating as partners and speaking up for safety, can all lead to decreased infection and injury rates as well. So let's move to patient experience, the trending and achievement. So I have a colleague who says, if you're standing still, you're falling behind. Think about that. As we are all striving to improve patient safety, if you're standing still, you're falling behind. So 3 key insights that have been uncovered through the ongoing research by CMS and in collaboration with national safety vendors to monitor the trends in patient-reported experience of care measures as reflected in the national HCAHPS measures. Patient experience results were strongly impacted by COVID and have only recently begun to return to those pre-pandemic performance levels. I don't think this is probably a surprise to anybody, but let's just think about this. The trend line reflects here that the inpatient HCAHPS overall rating of care, national mean from October of 19 through June of 23, and arguably the duration of the worst of the pandemic, you can see a spike in performance early on, but then an ongoing and precipitous decline over the next 2 years. Where the national trend line had previously been demonstrating an average rise of about 2% per year over year on average, we saw the loss of years of progress in a very short period of time during this pandemic. So what led to that? Early on, lots of things. Scarcity of PPE led to limited patient interactions, as well as restricted visitation by families, and patients kept in isolation and fear. Think about how lonely that time was. We had decreased communication, inability to interact with caregivers, and increased fear and anxiety. It had an immediate impact on the experience of care being delivered, as well as in how they used information available online about healthcare providers and organizations. There was plenty of time to do research on that. Consequently, it changed how patients built trust with those same caregivers. Patients no longer entered the healthcare space with an innate sense of trust, but rather really needed to establish and reestablish more personal connections in order to build that trusting relationship and establish that newfound confidence in their care providers. So of special note, in the early days of the COVID pandemic, hospitals and healthcare organizations were uncertain whether they should even continue gathering patient experience data, considering the unprecedented circumstances. So, however, they quickly discovered that patients were more accessible for feedback during the early stages of the pandemic. With more people staying at home, response rates increased, and individuals had time to engage with feedback about their healthcare experiences, contributing to the increase in healthcare consumerism that we discussed. So patient experience has been more volatile than in the last decade prior to the pandemic. As mentioned, we are only now seeing that return of performance in late 2023 into 2024, and at a rate different than previously observed. The hope is that these gains are maintained, but we are seeing more volatility now overall. The key drivers of patient experience: teamwork, safety, staff courtesy and respect, these are all enduring. They have come out of the worst of the pandemic with those lessons learned, and many organizations are learning how to address the same priorities, although in different ways, and are finding that they are pivotal in recapturing the progress that was lost during that time when we see this visualization of the trend. As I mentioned, with healthcare organizations beginning to focus on patient experience measures and the connection to quality and safety, if you are standing still, then you are falling behind. The national medium is back on the rise, and you want to be sure that you are helping to lead that effort in order to support integrated outcomes overall, rather than falling to the wayside. So now that we've shared a little bit of the bad news, there's some good news to share as well. So this is a word cloud, and it reflects a survey that was done asking patients in various countries and healthcare settings what is truly important to them, particularly in acute care. If you're not familiar with word clouds, it's really just a way to gather qualitative data, not just numbers, and visually display the information to be meaningful. So the bigger and bolder the words are, the more frequently they were reported in the survey. So here, the messages were very clear. The good news is that what matters most is a constant throughout, and it gets back to what drives loyalty. So let's think about competent care delivery. This truly is quality. This is quality care. Getting better, getting home. They want care, quality care delivery, and the biggest statement at the heart of the word cloud. Coordination of care. This is safety. Having things done quickly, efficiently, and in a coordinated way across the care continuum, hospital and non-hospital settings, and by a team approach rather than in those silos that we talked about. Courteous care delivery. This is the patient-centered approach that we talked about and is reflected here in how they want to be treated as humans and not just patients. Again, tying back human experience. The survey also revealed that only about 52% of these patients believe that their care providers knew what mattered most to them. That gives us an opportunity for a strategic approach that addresses what we know now patients want in delivering that safe, high quality, and patient-centered care, and how we should bring them into the conversation moving forward. In essence, supporting, encouraging, and valuing the patient voice is absolutely critical to delivering safe and high quality care. So in summary, that all having been said, when it comes time to create a strategy to address safety and patient experience in tandem, there is unfortunately no easy button to push, but we can offer a summary of recommendations to you to help your organization achieve success. So let's think about this. Foster a culture that prioritizes quality, safety, and that patient centricity. Facilitate good patient-provider caregiver communication. Promote transparency of information and support patient engagement. Ensure that the organization is accessible and empathetic to patient-specific needs. And prioritize quality outcomes to maximize that value. So with that, we thank you for joining us today and for your time. If you have questions, we would be glad to address those at this time. Thank you.
Well, thanks, Chris. That was such great information. So appreciate you sharing. Just as a reminder, if you do have questions, please feel free to enter those right into the chat. We'll be happy to address those real time here. Also, just as a reminder, we will be providing the slides of the presentation as well as the recording and follow-up today. So we should be able to get that to you here shortly. All right, so a couple questions that are coming in. Chris, I'm going to kick off here. I see one that just came in the chat. If only 52% of patients feel that providers understand what's important to them, do we need to improve and adjust intake questions to improve communication? Great question.
Improve and adjust intake questions.
Mhm.
So, I think I'm going to sort of go back when we think about what the opportunity is. And I'm actually going to sneak back here for a second. When we think about what our patients are telling us and looking at this word cloud. So these patients believe that their providers, only 52% of them knew what mattered most. I think it's not about how we change the intake. And I'm sorry, Gina, maybe you can help me clarify there. Did it say in the chat, because I cannot see it, the intake questions from the providers?
It didn't
Or are we
specify.
talking?
Yeah, it just
Okay.
said, do we need to improve and adjust intake questions to improve communications? I'm wondering if perhaps, and maybe Bonita Katz, if you want to provide a little additional context, feel free, but suspect maybe it might have to do with, preferred language, preferred, how do you learn best, things along those lines. I'm wondering if maybe that's what she meant.
Yes. Well, and I had a different thought, but I think I'm with you now with where she might be coming from, Benita.
Mhm.
But I think this is a huge opportunity. Two things I'll say. Yes, I think that, maybe we do need to consider what questions we are asking from the provider perspective to make sure that we actually are understanding and knowing our patients. But I'm also going to go back to what we've been talking about as far as the patient centricity and making sure that we have that connection with our patients so that trust is built and that they are comfortable sharing with us the whole story, because sometimes we get bits and pieces, but by building up that relationship, those are the proven strategies as far as being able to get those better patient outcomes overall, that 1 year post-discharge, survival rate, things like that.
Great. Thank you, Chris.
Thank you.
Sure. I had another question that actually just came over to me. In our organization, we encourage our employees to speak up to prevent errors and promote safety. Oh, that's great. How do you see this concept translating to patients speaking up?
Sure. So I think this is a critical component to really that patient experience and increasing safety across the continuum. Again, we have to look at that importance of the patient-provider communication and the overall relationship. So this is a huge opportunity for us to build trust, make patients feel comfortable, make them feel confident, and sharing the concerns. We talked at the beginning more about some of those medication errors and how we can prevent by listening to the patient. I, as a practicing nurse, had many times where information had to be clarified, or the patient, when you think about medication administration times, that's very personal, very patient-centric. And I've seen organizations across the country have standard medication administration times. So we have to think about what's best for the patient and how they've been doing their medication administration at home, and does that relate, and how do we prevent errors by listening to them? Even things such as patients sharing with us the symptoms that they are maybe having, which would be so important to share with their care providers, the team. Patients and families really need to be active participants and team members on that care team. They're the first line of defense when we think about safety and quality. And we just need to make sure that we're being very inclusive of that and encouraging and creating that environment in which patients are comfortable speaking up. I've also seen across the country, in line with when we think about our previous safety goals and so forth, speak up campaigns and really allowing patients and affording them that opportunity to be comfortable. And I think that we as providers have to be very thoughtful in our approach and how we are working with our team members and our of all disciplines to be able to respond when patients do bring up concerns. We want to have that thoughtful approach so that they are welcomed to share these concerns with us.
Great, thank you. It was a great example too about the medication administration time. I was thinking about times that certainly come up in my own experiences as well. Great, thank you. Okay, another question here. I actually have trouble getting our team, including physicians, to see the importance of patient experience. How can I get them more involved?
Great question. So we talked about healthcare being personal, and we all want what's best for the patient. So providers, I think, are no different in that aspect. And, they want the best outcomes for their patients. And when we think about what has driven all of us to be in healthcare, it goes back to that clinical case, and outcomes are important to not only patients, but they're important to providers. We want what's best for our patients, and providers want no different. They want that too. What got them into healthcare to begin with and wanting to help people and have the best possible outcomes and that optimal health, I think, is really the driving factor. And just to reflect a little bit on some of the other things that we said, yes, there's absolutely that clinical case, but there's also the business case of having a great patient experience and having the physicians being part of that and helping to drive that. That's very critical to success.
Great, thank you. And actually, we just had another question pop up in the chat. A little bit as a follow-up, a little bit different, but it's been my experience moving to a hospitalist intensivist model. Communication and accountable for transitional care have been a challenge. Any suggestions?
I think that goes back to some of the support and education that we do around this space, and making sure that, this is something that's at the forefront of all of our team members. And I think it doesn't matter what your discipline is, whether you're the provider, whether you're in nursing, whether you're in dietary or housekeeping. This is about really, I think, that patient centricity and how to build that within the DNA of the organization. We have to keep talking about it. I think as leaders of the organization, we have to be able to drive those conversations. And some of it, I think, also comes down to, how do we measure that success? How are we taking a good look at those quality outcomes? And if they aren't really where they want them to be, what are we doing about it? And how are we helping to hold people accountable and to be able to see the impact of good, high quality, reliable care can make on our patients across the country? It's not easy. I certainly respect and appreciate that. And I think that there's, a level of that there are some hard conversations that sometimes need to be had. But when we think about that guidepost and keeping that patient at the center, and that patient centricity, that's what we have to always keep in mind and always go after. Keep talking about it. Keep it on the agenda. We talked about the board, the C-suite, the leaders. It has to really be on everyone's agenda to be able to make this impact and move the organizations forward. But I would just say one more thing too. Is there another question, Gina?
I have one more question, but okay, please feel free to keep going. No worries.
No, go ahead. Maybe it'll tie in anyway.
Oh, okay. I was just going to say one more question that popped up. Our organization has tried to improve patient experience, really hasn't made much progress. Do you have any ideas? A little broader.
Yeah. Mm-hmm. Yeah. So I think, we've seen hospitals struggle to really get started with this, and it's something that we can certainly help with. There are some unique challenges, and they can be different for every organization. So I think really understanding the culture and the organization is important. It's a really important piece. Again, I feel like I'm repeating, but that patient centricity, we can help you sort of follow your already identified principles for quality improvement, because it can be very complex, and we want to support strategies to really think about that human factor and that human experience in all of this. A specific example that I would encourage you to think about if you are struggling is where to start, or how do you increase engagement? My question to you would be, do you have a patient and family advisory council at your organization? And if you do, what do you learn there? And how do you implement what the patients and families are sharing with you? I think we have to really listen. We can see what the scores are. We can see what the metrics are. We can look at HCAHPS. But when you really sit down and have those conversations and listen to what they're telling you, you can probably come up with a really tangible way to get started. We have to listen.
Great. Thank you. We actually just had one more question pop up.
Okay.
And just as a reminder, we do have a couple more minutes, so any more, please feel free to pop them in the chat there. But our organization has difficulty getting survey responses. Oh, yeah, we hear that, right? Any recommendations on how to get the public to participate in surveys?
This comes up a lot too, and I think that we have a lot of colleagues out there who work in this space and so forth. But one thing I'll say, and we've had recent conversation with an organization that, you might not have very many responses, and you might be, let's say you might be a smaller organization and you're just not going to get there. I think you have to really think about, and it ties back into my last comment about what are people telling you. So there's a lot of ways to get information. We know that we need to have some standardized approach to that, in utilizing the national vendors that are out there and so forth. But also, what are you doing to connect at the community level? And again, what are they telling you? There's lots of opportunity, I think, to listen as to how we can make impacts in our communities across this country. Talking, being open, creating some forums. Patient and family advisory councils are just one way. But I know in talking with a lot of our organizations across the country, we're very embedded into the communities. So people often are not shy to share experiences, whether good or bad. So I think it's about taking all of that in and sharing some of that feedback, and also creating some of those action items as to how we can help move forward.
Great. Well, thank you very much. It just scrolled through. I think we've gotten all of our questions addressed here, and we're just coming up on time. So I think we can wrap up.
All right. Thank you, everyone, for joining today. Appreciate your time and your attention to patient experience and being able to move quality forward across the country.
Thank you, everyone.